All the way in until you feel that touch. There you go. And then hold that. Wait for that stack to turn.
This workout's a workout for wusses.
Surgeons have to be fit.
That's it. Good. One more.
It's a physical sort of thing.
Good job.
You're supposed to do this once a week, but if you do it more frequently than once a week, body parts may start to fall off. Tell them to meet us on 5 South.
Oh, 5 South.
I need to set a fast pace.
Starting at 6 a.m.
Yeah.
6 a.m.
Finish. Take the elevators over here.
Elevators. And you have to be fit.
Yes, sir.
Perfect. I am intrinsically hardwired to be driven. Chop has a yearly fundraising poker tournament in Manhattan. And so you have all these guys where poker is their sport. So they make a donation to Chop, and they can play, and they're only playing for bragging rights. So I played. And I thought I'd just lose all my chips right away. You're going around the table, basically. Where do you work? Goldman Sachs. Where do you work? JP Morgan. You know, they're all these financial wizards. So I thought I was just going to play aggressively. So I started to win. I won like 10 hands in a row, wiped the entire table out. And it was sort of fun, and I'm never playing again, because I want to retire on the top, just like Sandy Koufax right there. So on the top, I never want to play again, because it'll never get better than that.
This little story is telling me about how competitive you are.
Very competitive. Are you kidding me? Are you kidding me? Of course. This is a workout that would kill 10 ordinary men. Tell them that.
Ordinary man. It would kill SEALs. Are you kidding me? Green Berets can't handle this stuff.
See you later.
It was strange to come home because everything looked the same, but we felt so different.
Just say help, please. We need help.
Physically, we've moved back in, but mentally, we still feel attached to all that happened in Philadelphia.
I know this is very hard to
Weakness and paralysis at the knee.
Complications from premature
may not be able to walk on her own.
Very high risk for preterm labor.
We feel like we've gone to war and we've come home, and the people ask you, how are you doing? And you don't even know where to begin.
She's doing better than we ever hoped. She could have been paralyzed from the waist down and have bladder and kidney issues. That was what we were expecting because her lesion was really high. And so far, none of those things are the case. Her bladder and kidney test was completely normal, which the doctor said was miraculous. And she's moving and kicking her feet all the way down to her toes.
It's a shock. It really is. But one of the challenges with spina bifida is hydrocephalus, which causes swelling in the ventricles where the fluid in the brain is created and stored.
So you have her car seat all in there?
It's a danger because then you can have a lot of delays mentally or developmental issues.
How late did you study last night?
11. Today's the day where they're going to tell us if her ventricles have swollen to the point where they need to intervene. We could either be ending this week celebrating and going into Christmas, or ending this week planning a brain surgery. I hate hearing that.
I know, a little cough is so sad.
Breaks your heart. She was supposed to have an MRI today, but because she's sick, has a fever, so they're gonna do an ultrasound instead. I'm looking for the size of her ventricles when I'm in there. And so I looked up, and sure enough, I mean, the ventricles were both pretty swollen. I try to get Shelly's attention, just let her know, like, I don't think it's very good. I saw some pretty big ventricles. We knew coming into it that was a possibility. Shit, I'm just following you.
Okay, remember this is where we met her before.
Oh yeah, psychiatry.
Yeah.
How are you?
Hi, good, how are you?
You here for Dr. Quayle?
Yes. Dr. Quealy is the neuropsychologist, and so she's assessing Lou's meeting the milestones that she should.
You put them in the cup. Lou, do it. Show me. Put it in. Put it up. Put it in. You show me. Here, look. In the cup. Lou, do it. Show me. Put it in. Or not. You're still so quiet. Can you talk to me?
It was meeting with the neuropsych doctor that I really felt like things aren't going as well as we thought.
Come get it. Come get it.
So going into the appointment with the neurosurgeon, I wasn't too hopeful that there would be good news.
Hi. Hi. You're not nervous. I'm glad. You don't need to be nervous.
Hello again.
Good to see you.
How's she been doing since I last saw you?
Physically, she's been doing more, verbally a little bit, but not as much. Sleeping, eating well.
Okay.
So overall, she's been doing well.
So I think Dr. Quealy talked to you, the neuropsychologist, and she's a little behind verbally. And it is of some concern. Obviously, we want to make sure that her development is optimized. Her ultrasound shows yet again the ventricles have edged up a little bit. So that, coupled with the fact that she does have this glitch in her neuropsych evaluation, makes me concerned. It's certainly not an urgent thing. She's not sick, but I'm starting to wonder if we're not going to have to treat her. Now, the way I've been treating hydrocephalus and spina bifida babies is to do an endoscopic procedure where you put a little endoscope through a little opening, sort of actually in the edge of the soft spot, pass it into the ventricle, and make an opening at the very base of the brain. And that allows the fluid to vent from the ventricular system into the fluid spaces that are at the base of the brain and that surround the brain. That's what I recommend that we do. And there's an excellent chance that would be the only thing she needs.
Is there a time frame that you're thinking?
Well, what I'm hoping is that we can get the MRI in the next week or two. I will see her again with the MRI, and if her head hasn't grown at all and her MRI looks surprisingly wonderful, then we won't do anything. We'll continue to wait, but I do think this is where we're heading. Any other questions?
Just gotta get you over this cold, baby.
Oh, you're welcome.
Glad you have no idea.
Let's get her home, get her rested.
It's okay.
If we're both honest with ourselves, yeah, sure, there are probably some things that we hoped would come of the fetal surgery, like no shunt, that may not be in the cards for Lou. But we still see quite a bit of improvement from the surgery. We set out to give her the best chance we could, and it was worth it.
When I think back on this past year and how extremely difficult it was, I mean it. I would do it many more times over.
It's pretty universal, you know, a parent loves their kid no matter what happens, no matter what. You see it every day in those elevators. You see it every day. And it used to be the thing I was afraid of. And here I'm living it.
Yeah.
So, this way.
Aww.
There was a very large donation made to Children's Hospital to develop a center of excellence for Friedreich's ataxia. And Grace was honored to speak at the launch.
Hello, my name is Grace. I'm a 6th grader. I go to the Episcopal Academy, and I love to read. Oh, and I have a progressive disease called Friedreich's ataxia. I think I spelled it wrong.
Yeah, it's got a K on the end.
Okay.
On the end. She prepared her statements pretty much last minute, so I guess in that way she was taking after me.
As it progressed, after I demanded to be recognized, a cure is coming. I would like to close out with a poem I wrote about the independence I would like to have and will have. The Queen of England. My brother hung a picture of Queen Elizabeth on my door. He did it to make fun of me, but I think it is true. At times I do feel like the Queen of England. Anytime I call, they come as quick as they can. If I say, get this, get that, everyone obliges. But being the Queen of England is not as glamorous as it sounds. I would rather be able to do it all myself. Thank you.
You're so good.
Having a baby is really hard, you know, but the joy you have from having a child is amazing. Like, I never imagined. Seeing your child smile, play, you know, I didn't know, like, you could feel that.
Every parent wants a perfect baby, right? What's perfect? Perfect is your own definition.
He's here. The baby's here. He made it.
I think about the ones that didn't make it a lot. It's very gratifying to see these kids. Look at this kid, 2 years old, running around like a normal kid. Of course, that's gratifying. But at the same time, you can never forget, you know, the people that didn't have as good of outcomes. Sometimes it just doesn't work out.
We're driven by patient needs. We're driven by babies who are born and we're too late to treat them. The damage has already been done. Baby dies or is severely disabled. We're driven by trying to find solutions to those unsolved problems. And so you put a lot of your own maybe petty comforts aside, and it's a miracle and a privilege to take care of patients, particularly babies. Babies are the future, right? What could be more compelling than a baby? Gosh.
Okay, hold it just like this.
This program was made possible in part by contributions to your PBS station from viewers like you. Thank you.